there was a 23-year-old girl
Okay.
who was about to get married in next 6 months, and she developed a rash all over the body 2 weeks ago, before to the onset of symptoms. And she was diagnosed to have some connective tissue disorder
Acha.
and started on steroids 2 days ago to the onset. And subsequently she developed a massive stroke, which was of the area where balance is there and conscious level is there. So when we identified with this disease, we immediately went inside and removed the clot after identification of 8 to 9 hours of stroke. Typical time frame for golden hour in stroke treatment is 4.5 hours.
Usually patients reach कब तक पहुंच पाते हैं?
Usually we see hardly any 20-30% of patients reaching in this golden hour.
So low.
So low.
And
Because the
what would
awareness is low.
So what age group are we talking?
So younger age group we are seeing from 20-30s. One of the most important factor is lifestyle.
Acha.
Second is habits. And third is B12 deficiencies. If deficiencies are there, so homocysteine is one enzyme
Acha.
which increases, which is not converted to B12, and it has the propensity to have clot formations.
Some they say that TIA is a pre-warning sign before a major
Yes.
stroke hits you.
Yes.
So what is TIA and what is a stroke and how does it differ from each other?
Stroke can be like sudden loss of vision, sudden tingling numbness of one side, and patient is fine later.
Okay.
Or only loss of balance, nausea, vomiting. People don't understand it's a stroke. It may be a vertigo or it may be something like acidity.
Meditating or walking, better for stroke prevention.
Both walking and
One is
meditating.
mental health and the other
Yeah.
one is physical.
Yeah, physical is walking
Huh.
or jogging, and mental health meditating.
Meditation.
Both with a balance is very important.
Stroke doesn't always come with a drama. No sudden collapse, no warning pain. Yet it can change a life in seconds. Often silent, sometimes subtle. It's one of the leading cause of death and disability worldwide. Today we unravel the critical role of an interventional neurologist, explore how an advanced stroke center are transforming emergency care, and spotlight the urgent and the need for awareness. Because when a stroke strikes, it doesn't wait. And what happens in those first critical minutes can decide whether a loved one walks, speaks, or survives. Joining us today is Dr. Shripal Shah, a distinguished interventional neurologist with advanced expertise in treating complex neurological conditions. With over 2 decades of training and intense experience in managing stroke and neurological condition, Dr. Shah specializes in cutting-edge procedures like DSA, acute stroke management, carotid and intracranial stenting, aneurysm coiling, and AVM embolization. His clinical journey spans premier institutions across India, including a fellowship in interventional neuroradiology from KEM Hospital, Pune. Dr. Shah's work sits at the intersection of precision, innovation, and life-saving care in neurology. Hello and welcome to Sahyadri Health Talks. I'm Dr. Tushita and today we have with us Dr. Shripal Shah. Hello sir, how are you?
I'm fine. How are you, ma'am?
I'm good sir. Welcome on Sahyadri Health Talks.
Thank you. Thanks a lot.
So,
it's a pleasure.
Thank you. And before we start this podcast, I wanted to congratulate you on the recent accreditation which we have bagged, which is Advanced Stroke Center for Sahyadri Hospital, Nasik. So a big congratulations on that.
Thank
and
you.
How does it feel to get that? Tell us more
We are
about
very
it.
excited and elated because it's the 7th Advanced Stroke Center in
Okay.
India
Okay.
and second in Maharashtra.
Wow.
And it is NABH and WSO accredited Advanced Stroke Center. So it's a great achievement for us.
So what I understand is it takes a lot of blood and sweat to get that, a lot of hard work.
Yeah.
So tell us about the journey of this.
See, because Sahyadri Pune and Sahyadri Nasik, Nagar Road, both were together working for getting this advanced stroke center accreditation, and it took lots of efforts to do it, because lots of documentation regarding the cases, type of cases, amount of work you are doing, and plus how many thrombolysis, thrombectomies, and how you are checking the pathways for these procedures, and how best in given time frame you are doing all these things under one roof and with one team togetherly and collectively putting your data and sending it
Lots
to them.
of documentation at the same
So
time.
accordingly we had a tough time, but we could do it. So we are very happy for it.
So it's all worth the effort
Definitely.
that went in.
Definitely.
So how does an advanced stroke center benefits the patient or the community, at large?
See, so I have to tell you the meaning what is advanced stroke center. So we have in India primary stroke centers, secondary stroke centers, and advanced centers.
Okay.
So everywhere those who are working and treating stroke patients, they are primary stroke centers. Going to secondary stroke centers where CT, MRI and doctors are there, neurologist, neurosurgeon. But advanced stroke centers are centers where from casualty to radiology, okay, to the team of doctors like interventional neurologist, neurosurgeons, neuro ICU backup team, and neuro rehab together are working in tandem for stroke patients, and diagnosing the patient, and in a given time frame we are treating those patients. So if a patient comes to a casualty with the symptoms of stroke, so his code white is activated. That is code white or code stroke is activated. Immediately the ER team, emergency medicine physician, sees the patient, diagnoses the patient immediately, and sends him to the CT or MRI, which should be done within 10 minutes or 15 minutes. And post that, immediately the treatment has to be started, like thrombolysis, which can be done in the casualty only, or then patient is shifted for thrombectomy, where a clot is removed from the brain using stent retriever or aspiration, done by an interventional neurologist, which I also do. I have a added benefit for that.
Yes, actually I wanted to ask you that. How does the role of an intervention, because we have heard of interventional radiologist, but very rarely we hear this super specialization of interventional neurologist.
Right.
So what is it, and how does this presence of an interventional neurologist in the panel makes a difference?
See, we have heard about interventional cardiologists.
Yes.
So they are the people who clean the pipes of the heart. Or they put stents in the heart.
Yes.
Okay. So this field has developed over a period of last 20-30 years.
Okay.
And similarly, in neurology, in strokes, which are ischemic in nature, there are clot formations in the brain where you have to remove the clot from the brain or then put stents in the brain. So we are plumbers of the brain. And what we do is plumbing of the pipes of the brain, and then we put the stent if required. So this field has advanced over a period of last 8 to 10 years. And we are hardly 200 neurologists all over India who are doing interventions.
That rare.
Yeah. So interventions is the field. It is the most important field which is developing in the field of neurology and stroke, where advancement has taken place. And how it helps is when a large stroke patient comes to us and a large vessel of the brain is blocked, we have to immediately remove the clot, because the conventional treatment or thrombolysis hardly works in 20 to 30% of this patient. If we don't remove or don't use this treatment, there will be permanent damage, permanent disability, or at least 30-40% of such patients die over a period of next 1 month.
Oh my God.
So such advancement helps us to treat the patients and see ki they get better cure over a period of time. So that way interventions has helped us to develop this field. And there are lots of paper studies last 5 years which has definitely advanced this field over a period. And in advanced stroke center, again, we have complete like neuro cath lab, neuro ICU, dedicated interventional team of neurologists like me. Secondly, backup of neurosurgeons is there. Intensivists who are neurointensivists trained in neuro ICUs.
Neuro
And
ICUs.
subsequently, once the patient are stabilized, they are shifted to wards, and neuro rehab team is there to take care of them before
So it's
discharge.
like multi-specialty under one roof.
Yes,
Yeah,
yes.
wonderful.
And we have time frame for every aspect of treatment we have to do. So
Acha.
these are the key factors to get this advanced stroke center
So
treatment.
basically, it is to ensure that once the patient is in,
Yeah.
then we do not stop at any point for any specialization to come and check.
Yeah, because
but
there is a golden
yes,
hour to the
yeah,
treatment.
Yeah. So help us. I mean, we know what is a golden hour. Here,
Yeah.
Okay, and it's very crucial.
Yeah.
So usually, what is the time frame that you usually see patients? Because of course, many people don't reach
Right.
early
Right.
in the golden hour. So what is that? Typical time
See,
that you
typical
see?
time frame for golden hour in stroke treatment is 4.5 hours.
अच्छा, and usually patients reach कब तक पहुंच पाते हैं?
Usually we see hardly any 20-30% of patients reaching in this golden hour.
So low.
So low.
And
Because
what
the
would be the
awareness
cause?
is low, or they
Acha.
don't know the symptoms of stroke, or
Acha.
delay in transfer to our hospitals is there in the golden hour.
अच्छा,
Secondly, people don't know that there is a golden hour for stroke.
अच्छा.
So treatment is also very important. So we say that in golden hours, maximum of the neurons which are dying can be saved, or the surrounding tissue which is going to die over a period of time can be saved, and it takes over the total recovery, which is ischemic penumbra. Penumbra takes over and helps for the recovery. But previously we used to say time is brain.
अच्छा.
Now time is not brain, tissue is brain.
Acha.
How much of the tissue
Is saved.
saved helps us to save the patient. So in this 4.5 hours, if the patient comes to us, we diagnose the patient immediately, and diagnose within a time frame, within few minutes, an MRI or CT scan is done. In the casualty only, we can start a treatment of thrombolysis, where the clot is there. We give IV lysis treatment, which helps to dissolve the clot, and the recovery of such patients is very faster.
Very faster, because obviously they came early. The treatment started early, so the
Right.
damage is much
Right.
controlled. So that explains all of it. So when you, as you spoke, right, in golden hour people come very late,
Right.
and the major reason for that is people are still not aware about the symptoms. So if you have to quickly brush up with, brush up the audience about the symptoms that must not be avoided at any cost, what would that be?
So first thing is, you have to identify stroke. We use a synonym called be fast.
Be fast.
Be fast means B is for balance. Immediately, if patient feels there is a loss of balance which is acute in onset, okay. Secondly, eye, that is loss of vision of one eye, which is unilateral and acute in onset.
Okay.
Or then fast, face, arm, speech, time. Face means if you see your face is twisted, or on one side, arm is one side is not working, or one half of the body is not working.
Does it have tingling sensation
Yeah.
or something like that?
Yeah, sometimes tingling, sometimes they may not able to lift the arm or the leg,
Acha.
or speak at all,
Acha.
or slurring of speech is there.
Acha.
And the time of onset, or how much time you have understood this duration of symptoms have occurred, and immediately you rush the patient with be fast to the primary advanced or a advanced stroke center.
Yeah.
So that is where you can identify. Because this year World Stroke Day, okay, is on 29th of October, and the theme of World Stroke is ki you should spot the signs of stroke.
Correct.
And act fast, because people are not able to understand the stroke symptoms, or they are not acting fast. Sometimes they mean it is not brain attack, it's heart attack.
Yeah.
So attack they don't understand it's a stroke, it's a paralysis. So they have to identify fast.
So why do you, what's your belief, if I have to ask you, why are people not aware of this? Because stroke is not a word which many of us don't know.
Now, if you understand, in your lifetime, out of 4, one person is going to get stroke. So if we four are sitting, out of us one person or
One person in this
25%,
room.
25% of the population is going to get stroke in their lifetime. It is so common.
Yeah.
But it is the leading cause of disability
Yes.
and second leading cause of death.
Death.
But people take it lightly. Previously, the attitude of people, doctors, was ki it's just a stroke. You will recover over a period of time, but they don't recover. And disability is not only of the patient, but it is totally of the family also, because financial burdens are there and they become disabled.
Yes, and
whole life
dependent.
and dependent.
Correct.
So it is so important to identify and act fast.
So, coming to the demographic part of it, earlier we used to see more strokes in elderly population.
Right.
But of late, there have been quite a few many cases
Yes.
of younger individuals, right?
Yeah.
So, what age group are we talking here?
So younger age group we are seeing from 2030s to
Okay.
up to 50s.
So
This is a young age.
30s, I mean, that early.
Yes.
And what is probable cause behind that?
See, there are many factors for patients of younger age group to get stroke.
Acha.
One of the most important factor is lifestyle.
Acha.
Second is habits. And third is B12 deficiencies, where
Okay.
if deficiencies are there, so homocysteine is one enzyme
Acha.
which increases, which is not converted to B12, and it has the propensity to have clot formations, which can be in the heart, it can be in the brain also.
Okay.
Fourth is cardiac causes.
Acha.
People have valvular heart disease, rheumatic heart disease, or any cardiac issues related, which can also, because the pumping of the heart 20% goes to the brain. So in a younger age group also we can see such patients.
Okay.
Fifth is ki these patients of stroke in the younger age group, they have hypercoagulable state.
Acha.
So what does that mean? The factors which are there for thinning in the blood itself are into they are not proper.
Acha.
And lifelong they have the propensity to have clot formations, which can also be one of the important causes for stroke.
So hereditary can also be a reason?
And sixth would be hereditary.
Okay. So while there are some modifiable and non-modifiable factors, as
Right.
we understand, what would be some prevention or preventive measures you would recommend here?
Yeah. First is lifestyle modification. So in lifestyle modification, sedentary lifestyle, definitely, fast food, these both can have a propensity to have high risk of stroke. Secondly, if you are not sleeping on time, adequate sleep is not there of 7 to 8 hours, good amount of exercise is not there, again it is going to lead to one of the causes of stroke. And thirdly, if your bad food habits are there, like having fast foods, junk foods, which can cause high cholesterol levels, triglycerides, okay, so this also can be a cause for stroke. So we can prevent
what
this.
What role has mental health to do with this? I'm talking
Definitely
about stress here.
Stress. So I think stress is part of our life.
Yeah.
And I think it is permanent for all of us. Only it can vary from up and down.
Yeah.
And happiness comes and goes, but stress is always there with everyone. So how do we deal with stress is very important.
Yeah.
Because stress leads to bad food habits, bad lifestyle, not a good amount of sleep, irregular. And in young patients, we see in women more causes of stroke because of hormonal imbalances, stress levels, and using of OC pills or oral contraceptive pills. So if they are using this for longer period of time, then there is a propensity again for getting stroke of such things.
Okay.
So I think we got to avoid all these things, and a good lifestyle, healthy lifestyle is important.
So another thing which is spoken very frequently when it comes to stroke management is something similar to stroke, which is TIA.
Right.
So what's the difference between TIA? Because many a times we see that TIA patients almost come back to normal.
Right.
Some of them they don't. Some they say that TIA is a pre-warning sign before a major stroke hits you.
Yes.
So what is TIA and what is a stroke and how does it differ from each other?
See, TIA means transient ischemic attack.
Yeah.
Transient means it comes and goes.
Achha.
Ischemia is there is a blood flow which is reduced transiently for a few seconds,
Achha.
few minutes or an hour.
Achha.
So that's a attack which is a warning sign.
Mm-hmm.
It is similar to before heart attack, people get chest pain
Mm-hmm.
and get some massive attack later over a period of time.
Mm-hmm.
So it's a warning sign for a minor to a major stroke.
Acha.
So those patients who has a TI, like one-sided tingling numbness, one-sided weakness, or a slurred speech for few seconds, few minutes, or an hour,
Acha.
and he improves
Acha. Or, I mean, without any treatment.
without any treatment.
Acha.
At least 20 to 40% of patients of TI may transform into a minor to a major stroke in next 48 hours
Acha.
to 1 week or 1 month.
Acha.
So that is very important for us to understand. It's a warning for a major event.
Uh-huh.
Okay.
Okay.
So we should understand that TI is also a minor type of stroke and it cannot be neglected. And we have to go to the doctor and identify all this after diagnosis.
Okay. So now moving to the last segment of it, which is the treatment part of stroke. While we see some patients who have completely recovered post a stroke, I mean, yeah, thanks to the advanced systems and also to a great extent where neuro rehab plays a role.
Right.
Some patients heal completely, while some patients don't, they never come back to their regular life. What's the reason behind it?
The reason behind it is one is identification and secondly timely treatment. Many patients who get timely treatment within a window period or immediately after the stroke has been identified, they would do better than people who are getting treatment after a late identification and late window of treatment.
Yeah, so that's one aspect of the golden hour.
That's one
also.
aspect.
Yeah.
There is one rule of 20 which is used in stroke.
Acha.
What does that mean? 20% of your patients will improve on routine treatment also.
Acha.
But that is 20% with small strokes.
Acha.
A moderate amount of stroke, 40% will improve. That is again rule of 20% increment. Okay. With IV thrombolysis, which is in the window period. Next 20%, that is up to 60%, cannot improve with spontaneous and IV thrombolysis. They require intra-arterial thrombolysis, where you go inside the brain through the vessel and use a thrombolysis which helps to dissolve the clot. That is 60%. But there are patients of large strokes which will not improve with conventional line of treatment or IV thrombolysis even in the window period.
Okay.
So they require thrombectomy or to remove the clot as earliest as possible.
Acha.
They improved by next 20%, that is 80%. 80% of this improvement will occur only with such time of treatment.
Acha.
So what in stroke is important is one is identification, but timely treatment of after identification, which patients require what type of treatment. Again, after the stroke has occurred, rehab also plays a very good role. So in rehab, definitely with so much advancement in neuro rehabilitation, use of robotics and use of multiple disciplinary approach in rehab also, like physiotherapy, occupational therapy, second is speech therapy, and other methods of treatment. Okay, this will help in rehab for next 20-30% of the patients.
So that's summing up the
it's a multidisciplinary approach, and what is tailored for what type of patient of stroke is very important.
Because it's not one size fits all concept.
Yes.
Okay, sir. So moving on to the next segment, which is mythbusters and a few quick questions. I'll read out a few lines. You'll have to tell us whether it's myth or fact.
Okay.
And maybe a one-liner explanation for the same.
Okay.
So the first one goes as, if symptoms go away quickly, it's not a stroke. Myth or fact?
Myth.
Okay. So I think
it's a TIA.
It's a TIA.
Yeah. So
it's
it may come back with a bigger warning.
Right. Signs. Okay. Strokes are always dramatic, collapsing, facial droop, and paralysis.
Fact.
Fact. Always?
Always. But sometimes stroke can be like sudden loss of vision, sudden tingling numbness of one side, and patient is fine later.
Okay.
Or only loss of balance, nausea, vomiting. People don't understand it's a stroke. It may be a vertigo or it may be something like acidity, but definitely it may be a stroke. So it's again a mix, myth or fact also, both.
Aspirin helps during all strokes, myth or fact?
Fact. Ischemic type of stroke.
Ischemic
type of stroke.
but not in the other type,
No,
right? So
no.
it cannot be used in every
Not
type,
every stroke.
not every
Hemorrhagic strokes we don't use any antiplatelets.
Okay. A mini stroke, TIA, is a major warning.
Yes,
Myth or fact?
fact.
Yes,
It's a
yes,
fact.
yes. Okay. Stroke can happen without pain. Myth or fact?
Fact.
Without. Okay.
Because there may not be any sign before that, and suddenly patient may collapse. Sometimes we have seen directly they become unconscious also with one-sided weakness also. There is no pain.
Correct.
Yeah.
1 in 4 stroke survivors will have another stroke. Myth or fact?
It's a fact. Because if the vessels are not good and there are large amount of blockages which are there in the vessels, recurrent strokes can happen in such patients.
Acha.
Or if there is a hereditary tendency, definitely they may get another stroke.
Acha.
So stroke bygones, another stroke.
Okay. Stroke or scissors, which is harder to spot quickly?
Both are harder.
Okay.
But sometimes more harder is कि a patient gets a stroke and a seizure with that. So it is difficult to understand it's a seizure or a stroke. Both may be a presentation of a stroke.
Okay.
But stroke is difficult. Seizure sometimes patient may pick up faster.
Older adult or young professional, who do you see more in stroke cases lately?
Lately we are seeing young patients more.
Okay.
But definitely older adults we are seeing. Causes are different.
But this new addition is the younger adults.
40 to 60s.
Okay. Okay. Genetic or lifestyle, which plays a bigger role in stroke today?
Lifestyle.
Okay. Meditating or walking, better for stroke prevention?
Both. Walking and
one
meditating.
One is mental health and the other one is physical.
Yeah. Physical is walking or jogging, and mental health meditating. Both with a balance is very important.
Okay. Blood pressure or cholesterol, which is the bigger silent threat?
Both are bigger. I feel blood pressure is bigger silent, but we see lots of patients who have high cholesterol. Only we see cholesterol, but the LDL targets, even we see higher LDLs, triglycerides, which are very commoner in Asian populations and Indian scenarios also.
CT scan or MRI, first test in emergency stroke care?
I feel if there is no MRI available, go immediately for a CT. At least rule out there is a hemorrhage and start treatment. But if not, where the centers are available, MRI is better because we can identify and we can prognosticate also.
And the last one is, women are more likely to die of a stroke than men. Myth or fact?
It's a fact.
Oh my God.
It's a fact.
Okay. And the reason being?
Reason being multiple issues. Like what we are saying, hypertension, diabetes, hormonal imbalances, dyslipidemias, lifestyle, stress, and genetic also, hereditary plays a very role.
Okay. So if you had a 30 seconds to tell every listener one thing about stroke, what would it be?
So what I would give a message
Yes.
to our viewers about stroke is totally preventable. It is treatable, but if you are able to prevent, but still you get a stroke, it can be treatable, but definitely curable also. But it has to be identified and it has to be treated in time. So tissue is brain, time is brain. Identify fast, act fast. So treatment would be fast and definitely cure would be faster and disability will be lesser.
That's about that. Now, before we let you go, we would want you to share some challenging case that you have, encountered. I'm sure there are lots like those. Share one story with us, which was quite challenging, but the results were amazing.
I'll mention about one case. Recently, I had a very bad time.
Acha.
There was a 23-year-old girl who was about to get married in next 6 months, and she developed a rash all over the body 2 weeks ago, before to the onset of symptoms. And she was diagnosed to have some connective tissue disorder.
Acha.
And started on steroids 2 days ago to the onset.
Acha.
And subsequently she developed a massive stroke, which was of the area where balance is there and conscious level is there. and main artery which supplies, that is basilar artery, was blocked.
Oh my God.
So when we identified with this disease, we immediately went inside and removed the clot after identification of 8 to 9 hours of stroke. And she recovered completely. But then we understood that her disease is something else, and which the primary disease is not stroke, it is the secondary problem, which is
Which
a
happened
vasculitis
because
of the primary connective tissue disorder.
Ah.
So she improved completely on the second day, and she was supposed to be shifted from the ICU. Third day, she developed massive stroke again.
Oh my God.
And that was of the one side of the body, and she lost her speech also. So already we had done thrombectomy. In sleep, she developed the second stroke.
Oh.
And we had to suppress her immunity immediately and treat the stroke also. So we had to give some specific medications for to suppress her immunity and to balance her with the routine stroke treatment also.
Achha.
So it was a very challenging
It was
scenario,
very complex.
very unusual case and very unusual scenario. So I had to involve the rheumatologist, hematologist, and myself together as a team working to balance the treatment. So subsequently, we started on immunosuppression. Then we gave advanced treatment like rituximab also later, and treated routinely like the stroke treatment. And now she is making a good clinical recovery over a period of time. But these are challenging scenarios where stroke treatments are okay, but the scenarios are such key identification and very difficult to manage such patients.
And the
family also,
yeah, where the stakes are so
and
high.
stakes are high, and most of them doctors in the family also. So it was a difficult scenario.
Okay.
And presently she is doing good.
How is she doing now?
She is doing good. She is
Okay.
walking with support, and I think she'll come out.
Oh,
Yeah.
that's wonderful to know that.
Yeah.
So that's wonderful to know about this girl. I mean, she almost got a second life, is
Yes.
what we can say. So a big congratulations on that. And I always wanted to ask you this: the department in which you work and the type of condition that you deal with, it's so stressful.
Yes.
So how do you manage to keep your stress levels in control, and how do you keep yourself so calm? Because I've always seen you so calm all the time.
As doctors, we are always in stress.
Yes.
I think doctors are facing lots of stress over a period of time now, because they take long years to study.
Yes.
Secondly, after studying, they have to get settled.
Correct.
Their counterparts, like their friends, are always been settled 10 years ago,
Yeah.
or 5 years at least before what we are. So we are not financially also secured. Then we are struggling to be developing our practice and getting stabilized.
Correct.
Once we are stabilized, the work front always gets on increasing. Plus the emergencies what we are handling are very difficult scenarios. And it's a demanding branch. So we are working, most of us are working in a demanding field where we are always on the forefront, or then we are going to have like on the relatives front, most of them backlashes can be there.
Yes.
So in this scenario, we have to balance ourselves. Once, we have to be calm and composed and do the best what we can do to our abilities. We are facilitators. We cannot be thinking always ki we are gods, or we are going to do what we are going to be there or doing the best is going to be the final treatment.
True.
We can do what is best. Results cannot be in our hand. If we understand this early, we'll be better to handle situations. Number one. Secondly, we have to do definitely meditate, exercise, eat on time, sleep on time. But as doctors, we always speak about this, but we
many
do not
times we
do not
do
follow.
that. True.
So I think that is very important for us.
Yeah.
Or to tell everyone. I'm telling to the audience, but it is for the doctors also to understand. We are also human beings. We can also face these problems anytime. So we have to have our own limitations and work accordingly as per our lifestyle also, and our mental makeup also.
Yeah.
How are we we cannot be always type A and try to keep on doing things and have again backlash on our own body.
Correct.
So I think we are trying to balance, but it's difficult to do that.
So balance is the key.
Balance is the key. Family also, health also, patients also, and definitely this is key for all doctors.
Sure, sir. That's about today's discussion. Is there anything else that you want to tell our audience before we wind up for the day?
No, it's okay.
It's all good.
Yes, it's all
Okay, sir.
good.
So, wishing you all good luck and all, best wishes for your future endeavors. May all those patients who needs the right treatment are able to reach out to you. And once again, congratulations on
Thank
the
you.
Advanced Stroke
Thank
Center.
you. Thank you.
And thanks for joining us today on Sahyadri Health Talks.
Thank you, madam. Thank you. It was a pleasure.
Thank you, sir. Thank you. Signing off, Dr. Tushita, Sahyadri Health Talks.